Having a newborn baby on the neonatal intensive care unit can be a very challenging time for parents, particularly when faced with a decision of whether to redirect care from full intensive care to palliative care or supportive care. Such decisions are considered appropriate by the doctor when the baby has a very poor prognosis or it's considered that the baby has a low chance of survival. Studies have shown, however, that parents report less than optimal involvement in the decision-making process. These conversations are also particularly challenging for doctors who initiate them, and yet there appears to be limited opportunities for training in this area, and the training is also locally decided. Research in this area has tended to be based on retrospective accounts, including interviews and surveys, leading an exploration of how decision-making conversations unfold, relatively underexplored. So there is a real need to systematically explore the black box of these decision-making conversations in order to provide an important evidence base of practice. So we recruited 31 families from one level 3 neonatal intensive care unit in London and recorded all their formal conversations with the doctors. We identified sequences of talk in which decisions to redirect care were raised, and we transcribed and analysed these using the method of conversation analysis. We found two distinct communicative approaches to decision-making, including making recommendations and providing options. It was found that different trajectories for parental involvement in decision-making were afforded by each design, as well as differences in terms of the alignment or interactional trouble between doctors and parents. So, making recommendations often led to misalignment and reduced opportunities for questions and collaboration from parents, whereas providing options led to an aligned approach with opportunities for questions and fuller participation in the decision-making process. So our research provides an important evidence base on how these decision-making conversations unfold in real time. This has enabled us to develop workshops using the Conversation Analytic Role-Play method, or CALM, which was developed and led by Professor Elizabeth Stokoe. CALM provides a novel approach to training where professionals are able to engage with real-life conversations and consider alternative approaches to communicating with parents, and then to see the implications for these alternative designs in terms of what actually happens next in the conversation. We are continuing to build on our corpus of conversations with the addition of video recordings now. This will enable us to continue to develop a project of work in which we systematically identify effective ways in which doctors communicate with parents in this particularly challenging context. Thank you.